Assalamu alaikum and good morning to one and all. Today we'll study about part 3 of drug used in special population and we'll see about the pediatric patient. So this topic we have started in the last session and we have seen that what are the different factors which affect the pharmacotherapy in the pediatric patient. So we have seen how pharmacokinetic and pharmacodynamic it may change due to different physiology in case of the children and the pediatric patient. I am Professor Sheikh Abu Sufyan. Welcome you to my YouTube channel Pharma Learning Forever. At the end of this e-learning session, you are able to explain about breastfeeding and effect of drug on pediatric patient and discuss practical aspects in prescribing drugs to pediatric patients. So let's start with the first topic learning outcome, that is the breastfeeding. So do remember that if drug enter the milk in pharmacological quantity, what it means, the mother is taking the drug and if this drug by virtue of its any property, if it is goes into the milk and if the same milk if it is given to the child, then that drug may affect that children and produce a certain level of pharmacological action. So if drug enter the milk in the pharmacological quantity, then breastfeeding it sometimes lead to toxicity in case of the infant. Why it produces the toxicity? Because obviously you are giving the high dose of the drug for the treatment of the maternal disease. So maternal disease it means the disease which happened to the mother. So in case of mother you are giving the high dose of the drug, and if equivalent amount of the drug which is present in the plasma, if it also enter into the milk, then obviously it is going to produce the toxicity in the infant if the same mother feeding the breast milk to that particular child. So the breastfeeding it is always risky for those mother who are taking the medicine for the treatment of some maternal diseases. So in such case, if the milk concentration of the drug, example the iodide, if it may exceed the maternal plasma concentration. What it means, so the concentration of the iodide which is present in a milk, sometimes it may be more even as compared to the plasma concentration of the iodide in the mother milk. So in such case, although the milk having the high concentration of the drug like iodide that you are taking in case of the treatment of the thyroid gland, so if it is going into the milk, but do remember that the total dose which is delivered to the baby, it is usually very small. So although the large amount of the drug it is remains in the milk, but the dose which is getting to the child or the child that receive the dose of the drug through consuming the mother milk, it is always very less. But although it is very less or this quantity or the dose is very small, but it is not safe, because sometimes even very small amount of the dose of the drug it can also produce hypersensitivity reaction. So to produce hypersensitivity reaction, it is not necessary that the child should get high dose of the drug. Even at very low dose, the drug can produce hypersensitivity reaction in the child. So looking at this, although the dose received is less, but the child is suffering from hypersensitivity reaction. Likewise, when the mother it is given with the medicine, so as a pharmacist or as a physician, you must consider that all the drug that reaches maternal systemic circulation will also enter the breast milk. So you must also consider this factor when medicine it is given to the mother. So when you are giving this medicine to the mother, you must look at its safety aspects. What effect it may produce in the child, so that you must foresee as a physician and as a pharmacist, and then accordingly you can give that medicine to the patient. But here the property of the drug it's play very vital role. For example, if the drug it is lipid soluble and if it is present in unionized form, so there are three property I am mentioning here. So the first property it is the lipid solubility. So drug must be the lipid soluble in nature. Second property, it must be that the drug must be unionized form. So it must be present in an unionized form. And third property, the drug must have the low molecular weight. If that is the case, so lipid soluble drug having the unionized form with low molecular weight drug, so such drug can easily enter the milk and it may produce the risk to the patient. Okay. So another aspects of the drug, it is obviously when we say about the ionized and unionized form of the drug, it is depend upon the pH of the drug as well as the milk. So the pH of the milk, it is weakly acidic, because whenever there is opposite pH, drug become ionized. If there is same pH, drug remains in unionized form. Okay. So the milk pH, it is generally weakly acidic, especially in case of the mother. So the mother milk having the pH with weakly acidic nature. And if drug that you are giving, if it having opposite pH, what is that pH? It is weakly basic in nature. Now acidic drug generally having the charge that is negative. So the milk having the negative charge. And if the drug, if it is the basic in nature, then it is going to have the positive charge. So now both having the opposite charges. So in such case, the drug, it may start concentrating into the breast milk by trapping the charge form of the drug. Why there is trapping? Because always the opposite charges, they attracted towards each other. So since milk having negative charge, and if the drug having the weakly basic nature, so it having positive charge, so this drug will start trapping into the breast milk. Okay. And if such drug it is given to the patient, breastfeeding should be, it may produce the toxic effect and it may be the risky to the infant. So what precaution you can do? So in such case, the breastfeeding should be ceases during the treatment if there is no safe alternative drug is available, because the health of mother is also very important. So if no other drug is available which is not cumulated into the breast milk, then in such case that mother should not allow to feed the child with her own milk. So you can put that child on the external milk, like you can give the cow milk, or you can give some other external milk which is available in the dry form that can be reconstituted, water can be added, and those external milk can be provided to the child. Okay. So this is in case of the drug which having the weakly basic in nature. Why? Because it generally trap into the breast milk due to their opposite charges, and the breastfeeding, it may be the risky, it may produce toxic effect in case of the infant. So to avoid that, what you are doing, to safer side, you are not allowing that particular mother to feed milk to the child. Okay. So these are the basic aspect of the feeding mother milk to the child if the mother is on the treatment with the medicine. Now let's see what are those drugs which must be avoided during breastfeeding. So either you can avoid this drug giving to the mother who is feeding to the child, or second option will be you can continue the treatment and you can put child on the external milk. Okay. So both the option can be possible, and it's all depend upon what is the health of the mother. So if the health of mother, if it is the priority, if she is suffering from some severe diseases, then in those cases you need to give medicine to the mother. Okay. So let's see what are those drugs which can be avoided during the breastfeeding. So drug like amiodarone and the aspirin. So the amiodarone, it is generally used in case of the hypertension, also in case of the arrhythmia. So you are using this drug. Aspirin you are using for the many purpose like anticoagulants. You are using it as an NSAID. So aspirin, many alternatives are available, right? So it depends on the health of the mother. You can decide whether to continue the drug treatment or to stop the feeding of the milk to the child. So the amiodarone and the aspirin. Likewise, the benzodiazepine, it is generally most given in case of the convulsion. You should avoid this in case of the breastfeeding mother. Chloramphenicol, ciprofloxacin, and cyclosporine. So the chloramphenicol and ciprofloxacin, these are the antibiotics. Cyclosporine, it is the immunosuppressant drug. So it may also produce toxic effect if it is present in the milk, and if that milk it is given to the child. Okay. Likewise, cocaine. So cocaine, it is always dangerous. So generally it is not given for the treatment of the disease. But if mother, if she is the drug addict, so generally it is very common in case of the Western countries. So most of the mothers, or some mothers, they are the drug addicts, and they doesn't remain without the cocaine. So in such case, it is risky to the child. Okay. So the cocaine, likewise combining or combined oral contraceptive where you are giving two oral contraceptive to avoid the pregnancy, it may also produce bad effect in the child. Then cytotoxic drug you are giving in the treatment of the cancer, it is not safe in case of the child. And ergotamine, especially which is used during the delivery of the baby, or it is also used as a oxytocin drug, so it also produces bad effect on the child. So these are the different drugs that must be avoided in case of the mother who is feeding milk to the child. Okay, so likewise n number of drugs are there, but what I did on priority basis, the important drug I have listed in this slide, because all drug I cannot list in today's session. So you can go and refer through different books, or you can just Google out what are the list of the drugs that should be avoided during the breastfeeding. Okay. Now let's see what can be done when particular drugs are given to the mother, because every time avoiding drug to the mother, it is not possible, because she is also suffering from the disease, and every time also giving external milk to the child, it is also not a feasible option. So what you can do in such case, infant should be monitored if the drugs which are at the risk which are given to the mother. Now let's see why it is to be monitored and what could be the risk in case of the children if those drugs are given to the mother who is feeding milk to the child. So let's see one by one. So first category is the beta adreno receptor antagonist. So if it is given to the mother, like the propranolol, atenolol, so these are the common drug you are giving in case of cardiovascular disorders. So if you are giving beta adreno receptor antagonist, then there is possibility of causing bradycardia in case of the infant. So if it is given with the beta adrenal receptor antagonist, then what you can do in case of the child, you can measure the heartbeat. Why it is important? Because the beta adrenal receptor antagonist, it produces the risk of bradycardia to the infant. So you can just monitor their heartbeat, and if you feel that the child starts showing the adverse effect related to beta adrenal receptor antagonist, then in such case that child should not be fed with the mother milk. So this could be the option. So you can continue the mother milk till the time the child is not showing sign and symptom of the toxicity. Okay, so that is the reason why I mentioned the infant should be monitored when these drugs are given to the mother. Okay, so first category is beta adrenal receptor antagonist. Second category is the carbimazole. So carbimazole, it is given to the mother if she is suffering from hyperthyroidism. So what carbimazole is doing, it reduces the hyperactive thyroid gland and it reduces the thyroid hormone. Now the same dose of carbimazole, if it goes into the mother milk, then it quite possible that in such case even low dose can produces the hypothyroidism. In case of the therapeutic dose, it increases the risk of hypothyroidism in case of the neonates and the infant. Okay, so what you can do in case of carbimazole, since there is a risk of producing hypothyroidism because it reduces hyperactive thyroid gland, but in case of child there is no hyperactive thyroid gland. The thyroid gland, it is normal, right? So if same dose if it goes to the child, it may produces the opposite disease, that is hypothyroidism, right? So what you are doing to avoid that, you can prescribe carbimazole at the lowest dose to the mother who is feeding milk to the child, so that there is no risk of hypothyroidism. So always there is solution for the problem, right? So we have seen two drugs, beta adrenal receptor antagonist. Second one, it is the carbimazole. The third drug, it is the corticosteroid. So if corticosteroid, if it is given to the mother, then in such case at high dose it can affect infant adrenal function. So since it affects infant adrenal function, you must see that high dose of corticosteroid should not be given to the mother who is feeding milk to the child. So this is example of the corticosteroid. Next, in case of lithium, so lithium, it is generally given in case of bipolar disorder. We have seen it helps to maintain the mood, conversion of the mania into the depression, and from the depression into the mania. So if there is possibility of swing mood is there in case of the mother, then that mother, it is kept on treatment with the lithium. But remember that the lithium, if it is given to the mother, this will go into the milk and it may cause intoxication to the suckling infant, because lithium, it is already the drug with very narrow therapeutic index. What it means, it having the high risk of producing the toxic effect. So if the drug it is given with the high risk of producing toxic effect, then that drug, it is obviously going to produce toxic effect in case of child as well. So either you can stop giving milk to the child, so mother should not give the milk to the child, or you can switch over to another drug which cannot produce intoxication in case of suckling infant. Okay, so we have seen about the lithium. Then in case of the aspirin, so aspirin, it is the well known to produce the Rey syndrome. So even if it is given to the child, in child it produces the Rey syndrome. So if mother is taking the aspirin, and if the dose of aspirin goes to the child, it produces very severe or risk of the Rey syndrome. So what is Rey syndrome? So there is the swelling of the brain and the liver, which is very dangerous in case of the child. So it may produce in case of the aspirin. So we have seen the different drug what it produces if it is given to the mother. Likewise, if you are giving bromocriptine, and in case of the large dose of diuretics, it may suppress the lactation. And you know that in case of the mother, the lactation means secretion of the milk is very important. And if the mother is on the treatment with the bromocriptine or the diuretics, you may see that the lactation it reduces. And since lactation is reduced, although that child is suckling the breast milk, but since that child is not getting that milk, that child is keep on crying. So now why that child is crying? It is crying because although the child is suckling the milk, that child is not getting the milk due to suppression of lactation by bromocriptine and diuretics. Okay, so you should be very cautious when you are giving bromocriptine and diuretics to the mother. So if the symptom is there, like the child is keep on crying, what it means? It means that child is hungry, that child is not getting the milk because due to suppression of lactation by bromocriptine and diuretics. So in those cases, you can keep that child, or you can give additional external milk to that particular child to satisfy their hunger. Okay, so this is in case of bromocriptine and the diuretics. Likewise, metronidazole, it produces the metallic taste. So since metronidazole already having metallic taste, obviously when if it goes into the milk also become metallic in nature. So it give very unpleasant taste to the milk. So sometimes you may see that the child is not suckling the breast milk. And why it's happened? It may happen due to the maternal treatment with the drug. The mother was given with the metronidazoles. Now that metronidazole is come into the milk, and the milk has got unusual, unpleasant metallic taste. And since this taste is there, that child is not suckling the breast milk. Okay, so this could be the different problem when different drugs are given to the mother. Now let's move on to the next part of today's session, that is practical aspects of prescribing medicine to the child. So when you are prescribing medicine to the child or the pediatric patient, you must consider both pharmacokinetic and pharmacodynamic changes. You have to also consider about the child physiology, their body weight, and n number of factors. Okay, so do remember that if you are giving the medicine to the child which having very narrow therapeutic index, then in such case the expectation is that you are giving accurate dose, because slight increase in a dose it may produces the toxicity, and slight decrease in a dose it may produces the under effect, and you don't want that. You want accurate dosing. Then in such case neither oral dose work nor intramuscular dose work. So what is practical solution to this? If you want to have the exact accurate dose in case of the child, and if drug having narrow therapeutic index, then in such sick neonates you can give the IV route. You can give the drug through the IV route. So IV drug administration help you to provide accurate dosage to the sick neonates. Okay, so as far as the route of administration are considered, accurate dosing could be possible only through the IV route of administration. Okay, but there are many alternatives are also available that may be considered if the possibility of cannulation it is not there in case of child. Suppose sometime you bring child to the hospital, but nurse is not available or the expert person is not available who can give IV injection or who can put the cannula into the small vein of the child. In such case, other alternative routes are also available. But do remember that for accurate dosing, the best option it is the IV drug administration. So this is the first practical aspects. Second thing that you must consider is that in case of the child, they having difficulty in the swallowing. Then in such case, do you give the capsule or do you give the tablet to the child? Obviously not. Then if you want to improve the compliance in case of the pediatric patient, then to overcome this, what you can do, you can give the liquid preparation with very pleasant and sweet taste. So the liquid preparation that you are giving, if you put good flavor like strawberry, orange flavor or something else which is loved by the child, then that child will love to take the medicine. And secondly, the sweet, it should have the sugar. So in that case, it increases the compliance rate in case of the child, right? Otherwise, if you are giving bitter medicine, that child will run away from taking the medicament and it may lead to the non-compliance. So to improve compliance, what you did, you have added good taste. So you have added the pleasant medicine, you are giving pleasant medicine to the child, and secondly, you have added the sucrose so that it can have very good the sweet taste. Okay, but do remember that always giving the sucrose, or if you are giving the more the sweet medicine to the child, then such medicine it also increases the problem in case of the children. And now let's see what could be what are those problems. It could be possible in case of the child if the child is given with the sucrose. Okay, so if the child needs chronic treatment with the medicine, then do remember that the chronic use of the sucrose, it may lead to tooth cavity, because the sugar, it is not good for the teeth, and the teeth are growing, the child also taking the milk, and they are not doing the brush like us or the young child, so they are not cleaning their teeth on regular basis, right? So that sucrose which is accumulated into the teeth, it may increases the possibility of the tooth cavity. It may also increases the risk of the gingivitis. So gingivitis, it is the swelling of the gums, and sometimes the bleeding is occur, and the child keep on crying due to this problem. Your child is suffering from the tooth cavity and the gingivitis, and this could be possible if you are giving the sweet formulation for a long period of time. So always the chronic use of the liquid preparation with very sweet taste, it is not advisable, although it increases the patient compliance. So this is another practical aspect of prescribing drug to the child. Next one, do remember that there are some dye and coloring agent you use to attract the child, like you are using the strawberry color, you are using the orange color, so that that child consider that it is a good the juice and it's not a medicine, right? So although the dye can give good solution to this, but sometimes some child, they suffer from hypersensitivity reaction to the dyes and coloring agent. So if there is history of the child having hypersensitivity reaction to the particular coloring agent, then those coloring agents should not be used in case of the children. Likewise, pressurized aerosol like salbutamol inhaler, if child is suffering from the bronchial asthma, then giving pressurized aerosol, it is not practicable in case of very small child. It is only practicable in case of the children over the age of 10 years. Why? Because you are giving instruction to the child, like inhale. After giving the salbutamol aerosol, you ask child to inhale inside, right? But if his comprehension and understanding is not good, how come that child will inhale the salbutamol inhaler, isn't it? So it is only practicable giving the pressurized aerosol of the salbutamol in case of the children over the age of the 10 years. So these are another practical aspects. Then in case of topical application, the giving drugs through the nebulizer, it enhances local therapeutic effect and reduces the systemic toxicity. So you know that since the patient cannot follow your instruction because the child having the very small age, so what you can use the nebulizer. So nebulizer, where you are putting mask on the face of the child and you are giving medicine through the nebulization. So when you are giving through this route, it is not going into the blood circulation, it is directly going into the lungs, and it helps to control the asthma. So it is very easy way of giving medicine to the child. So generally nebulizers are preferred in case of the child because it can be easily given, and it also reduces the systemic toxicity which is associated with the drug, because drug it is targeted only to the lungs and not much of the drug it is going into the systemic circulation. Then next part it is if the child's skin, if it is inflamed, or the child's skin if it is the broken, then in such cases if you are putting drug or if you apply drug to the inflamed skin or to the broken skin of the infant, it causes systemic absorption of the drug like the steroid and the neomycin, and it may produces the toxicity. So we have seen that even in case of the infant, the skin it is very thin, and since the skin is thin, even topical administration means just application of the drug on the skin, it may lead to their absorption into systemic circulation, and it may produces the toxic effect. Okay. Likewise, when you give drug through the intramuscular route, we have seen that the absorption it is very fast, so it should be used when it is absolutely necessary. Every time should not be used, it should be used whenever it is absolutely necessary, or as far as possible you can avoid giving drug to the intramuscular route. Likewise, IV route, just now we have seen the IV route in case of the child it is less painful, but problem is that in case of IV route you need the skilled person who can cannulate the infant vein, because infant vein is very small. So cannulating infant vein, it is not as easy as cannulating the adult vein. So it is, since it is very difficult, so you need the skilled person to cannulate the infant vein. In addition to this, children also find IV infusion very uncomfortable and restrictive, because children having ability to move from one place to another place. So it is very challenging to restrict child at one place. So if you are giving IV infusion, then children has to remain at one place. So it may produce very uncomfortable situation to the children, and it is also restrictive to the child. So although it is less painful and giving very accurate dose, but these are also some limitation when you are giving drug through the IV route to the children. Okay. So in such case, suppose it is very difficult to cannulate the child, then another route of administration, it is the rectal administration. So it is very good alternative to the IV route. So it is the convenient alternative because anyone can administer. You don't need the skilled person. Even mother of the child can also give the drug through the rectal route. So it is the convenient way of giving the drug. It can be used when child is vomiting, because if you give the liquid preparation to the child, if the child is vomiting, then it may come out through the vomitus. So you cannot give through the oral route. So in such case, you can also prefer the rectal route. Then you can also administer the rectal metronidazole to treat anaerobic infections. Suppose child is suffering from the GIT infection, then you can administer the rectal metronidazole to treat this anaerobic infection, right? Likewise, the rectal diazepam can also be given for the treatment of status epilepticus. So suppose the child is feeding, and if the hospital it is not nearby you, then in such case you can keep the dose of rectal diazepam that can be even administered by the mother. Okay, so the parent can also administer the rectal diazepam and can avoid the status epilepticus, that is very severe seizures which are occurring in case of the child. Okay, so these are different practical aspects that we have seen. In addition to this, as a pharmacist, the proper communication with the parent, it is very important, because whatever instruction you are giving to the child, that child will not remember the instruction, because the child is not in the position to comprehend your information. So in such case, the counseling of the child parents, it is very important. So now what type of counseling is needed and what information must be provided to the parents, let's see that. Okay, so this information should include how to administer the drug. Suppose the oral route, or if it is reconstituted medicines, then proper instruction should be given to the mother on how to administer drug to the child. Likewise, why the drug being prescribed, so that is very important. So you must tell why particular drug is given to the child, and how long it is going to take to produce the pharmacological action. So that also you explain. Otherwise, mother, they are always anxious. They look for the immediate action, and if it doesn't happen, they sometimes switch over to another drug or switch over to another physician, and in the process of keep on changing the physician, the child health it is get affected. Okay, so you must also tell why the drug it is prescribed to the child. Likewise, how long treatment should be continued, just now I have mentioned that also you need to explain. Or sometimes what happen in case of, especially in case of antibiotics, it is generally given for the 5 days or a week, and when the child become fine, mother stop giving medicine to child, and it may lead to relapse of the infection. So to avoid that, you also tell to the mother how long that treatment should be given to the child. Okay. Then whether any ADR are likely, that any adverse effects can be seen in the child, then you can tell mother to supervise that ADR. If that is the case, if there is adverse drug reaction it is seen, then you can tell mother to contact to the physician, right? So these are different practical aspects of giving medicine to the child. Now we'll see giving medicine to the child, not to the mother. So till now we have seen about giving medicine to the mother and produces ADR to the child. Okay. Now we'll see what are those drugs which directly produces adverse effect in case of the children or pediatric patient. So we'll see the list of the drug and what it produces. For example, in case of chronic corticosteroid treatment, it is observed that the chronic corticosteroid, if it is given to the child, it inhibits their growth. So that could be the problem. And if the growth it is inhibited, that child become weak, their height it is reduced, and that is not a good reflection on the child. So chronic corticosteroid must be avoided in case of the children. Likewise, aspirin, although if it is given to the mother or child, the problem produced is same, that is it produces a Rey syndrome. So it is avoided in the children under the age of the 16 years due to association with the Rey syndrome, that is the swelling of the brain and the liver. So you can avoid it. Next drug, it is tetracycline. Tetracycline, it is the drug, it is deposited into the growing bone because it having the charge, and the bone contain the calcium, so it deposited into the growing bone and the teeth, and it also causes the staining and occasionally dental hypoplasia. So that is not good in case of the child, because the bone, if it is it form complex with the tetracycline, and if the teeth also form complex with the tetracycline, then in such case there could be the possibility of the weak bone and weak teeth. Okay, so what you are doing, the tetracycline is generally contraindicated in case of the children. You are not giving tetracycline to the children, right? So there is the third drug. Fourth drug, it is the fluoroquinolone. It produces damage to the growing cartilage. Okay, because the cartilage, bone, everything is growing in the child, and if you are giving fluoroquinolone, it produces damage to the growing cartilage. So again, fluoroquinolone can be contraindicated in case of the children. Likewise, metoclopramide, it produces the dystonia. So that is another severe symptom which is produced in case of the children. Valproate, it produces the hepatotoxicity. It is very important toxic effect of the valproate. So valproate, although it is very good anticonvulsant drug, but do remember that you should not give this drug to the children. It is not prescribed in the children because it having high risk of producing hepatotoxicity, and the liver is the major organ, right? So you should not give valproate in case of the children. So this is all about the drug that should be avoided in case of the child. Now let's quickly see one case study and then I will stop my session. Okay, so just you can read out the instruction. So a 2-year-old epileptic child has been fitting for at least 15 minutes. So that child suffering from the fit for at least 15 minutes. And then what you did, actually as a parent, what you did, you have taken that child to the hospital. But in a hospital, casualty officer is unable to cannulate the vein because vein is very small, right? And that officer is unable to administer IV diazepam. So it is not possible to give the IV diazepam because whatever causality officer is available in the hospital is not skilled enough to cannulate the child vein, right? So you are not able to give IV diazepam. So this is another condition. Second condition was the more experienced medical staff are dealing with emergency elsewhere in the hospital. So that skilled person will also not come to you and help to reduce the fitting or the seizure in case of your children. Now in such case, my question is, name a drug and their route of administration with which causality officer may terminate the convulsion. Yes. So now whatever I have mentioned, you apply your knowledge. We have seen different practical aspects of giving drug to the child. Now you tell me in such situation what you can do or what causality officer can do to avoid the seizure in case of the children? Yes. So let's see who give first answer. I'm waiting for your answer in chat box.